Question 1. A 28-year-old woman presents with fatigue, malaise, and intermittent right upper quadrant discomfort. She denies alcohol use or medication use. Labs show elevated ALT and AST in the 400s with mildly increased bilirubin and a normal alkaline phosphatase. Serologic testing reveals positive anti-smooth muscle antibodies, ASMA. Liver biopsy shows interface hepatitis with plasma cell infiltrates. What is the most likely diagnosis? A. Autoimmune hepatitis. B. Primary biliary cholangitis, PBC. Wilson disease. D. Non-alcoholic fatty liver disease, NAFLD. E. Hemochromatosis. Correct answer. A. Autoimmune hepatitis. Autoimmune hepatitis type 1 typically affects young to middle-aged women and features elevated transaminases, positive asthma, and interface hepatitis with plasma cells on biopsy. Why not the others? B. PBC, characterized by antimitochondrial antibodies and cholestatic lab pattern. C. Wilson disease, presents earlier, teens to 20s, with low ceruloplasmin and Kayser-Fleischer rings. D. NAFLD, associated with obesity and metabolic syndrome, lacks autoantibodies. E. Hemochromatosis, presents with elevated ferritin and iron saturation, often in older men. Question 2. A 7-year-old girl is brought in by her parents due to jaundice, abdominal discomfort, and poor appetite for several weeks. Labs show elevated transaminases, AST/ALT 1000, hyperbilirubinemia, and increased gamma globulin levels. Testing is positive for anti-liver kidney microsomal 1 anti-LKM1 antibodies. Which of the following is the most likely diagnosis? A. Autoimmune hepatitis type 2. B. Alpha-1 antitrypsin deficiency. C. Biliary atresia. D. Hepatitis A virus infection. E. Primary sclerosing cholangitis. Correct answer A. Autoimmune hepatitis type 2 anti-LKM1 antibodies are characteristic of autoimmune hepatitis type 2, which typically affects children and adolescents and is more aggressive than type 1. Why not the others? B. Alpha-1 antitrypsin deficiency shows past-positive globules in hepatocytes, not autoantibodies. C. Biliary atresia, a neonatal condition causing cholestasis and colic stools. D. Hepatitis A presents acutely but usually resolves spontaneously and lacks autoimmune markers. Rare in young children and is associated with IBD and PNCA, not anti-LKM.